Most people treat lower back pain and bladder problems as normal, something you just live with. But what if I told you that in most cases, the real problem isn't your back, and it isn't your bladder either? It's a part of your body almost no one talks about, and almost everyone ignores: your pelvic floor. I'm Dr. Alyssa Thompson. For over 7 years, I've worked clinically with patients who were frustrated, uncomfortable, and confused about why their bodies felt weak, unstable, or out of control. And time after time, I saw the same pattern: strong arms, strong legs, but a neglected pelvic foundation. Here's the truth most people never hear. Your pelvic floor is the control center of your core. When it's weak or tight, everything above it suffers. Your lower back, your hips, your bladder control, even your posture and balance. Today, I'm going to show you 3 precise movements that target this hidden system directly. Each one takes just 15 seconds, and when done correctly, they can dramatically improve stability, circulation, and relief, without equipment, without pills, and without complicated routines. Let's begin. Exercise 1, the bridge pose. This is where real strength starts. Lie flat on your back, bend your knees, feet planted firmly on the floor. Now, lift your hips slowly toward the ceiling. Hold this position for 15 seconds. As you hold, consciously squeeze your glutes and gently engage your core. This isn't just a lower body exercise. It directly activates the pelvic floor, teaching it to support your spine the way it was designed to. When patients struggle with recurring lower back pain, this is often one of the first movements I prescribe, because it rebuilds strength from the inside out. Exercise 2, the adductor stretch. Next, we address tension, the kind you don't realize you're carrying. Sit down, bring the soles of your feet together. Let your knees gently fall outward. Hold here for 15 seconds. Tight inner thighs place constant strain on the pelvic floor. Over time, that tension disrupts blood flow and pulls the pelvis out of balance. This stretch releases that pressure, restores mobility, and allows circulation to return to the entire pelvic region. Most people feel relief from this one immediately, and that's not a coincidence. Exercise 3, child's pose. Now for the most underestimated movement of all. Kneel on the floor. Sit back on your heels. Reach your arms forward as far as you comfortably can. Breathe deeply for 15 seconds. This is not just a relaxation pose. From a medical standpoint, it lengthens and decompresses the pelvic floor muscles, calming the nervous system and relieving chronic tightness that builds up from stress, sitting, and poor posture. For many patients, this is the moment their body finally lets go. Here's what I want you to remember. You don't need extreme workouts to protect your body. You need consistent, intelligent movement that supports the systems holding everything together. 15 seconds, 3 movements, a stronger, more stable foundation. If these expert insights helped you, make sure to subscribe and join our growing community. I'm Dr. Alyssa Thompson, and when you take care of your foundation, your whole body follows. I'll see you in the next video.